So we're going to finish up our first part of this unit on the central nervous system that deals with the spinal cord and the meninges with just a little bit more information. So I couldn't fit this into the other lecture. So this is just a short continuation on what I was talking about in the last lecture, which are the ventricles and more specifically the cerebral spinal fluid, which travels not only from the ventricles down the spinal cord, but back up around the spinal cord and around the brain. And remember that cerebral spinal fluid is there for several reasons. First off, it's there to cushion and protect the brain and spinal cord from injury, also from temperature, right? The fluid is going to help keep a stable temperature. And also there are nutrients in that cerebral spinal fluid. It's from the blood. It's not blood, but it's pulled from the blood, and thus it has a lot of the nutrients that are going to be found in blood, like ions, things like that. But we can also use this to help diagnose some situations. So you may have heard of a spinal tap before, or the correct term for it is a lumbar puncture. So I'm going to finish up this section, or this part of the section, I should say, with a little bit of information on something called the lumbar puncture, and then we're going to talk about a condition called hydrocephaly, which is a pretty common condition, but thankfully it has a treatment option, which works great. So let's get started. So first off, let me just go back to an image that I think might be helpful. So if you take a look here, this is a picture of the central nervous system. We have our brain and our spinal cord, right? And then what I have here is just this little purple line is supposed to signify the arachnoid mater. Now, that's not an accurate representation. The space is very small, but obviously I can't draw it that way. But what I want to point out to you is that in this space here, this is where we're going to have our cerebral spinal fluid. So our cerebral spinal fluid is going to start being produced in the ventricles, right? So it gets produced in the ventricles, the lateral ventricles. It then travels down to the third ventricle, eventually makes its way to the fourth ventricle, and then it travels down the central canal of the spinal cord. And when it gets to the bottom, it actually comes back up. And I use the analogy of a fountain, and I think it's a good analogy. The fountain is going to have that cerebral spinal fluid flow back up the sides of the brain, and then it's going to get reabsorbed in that dorsal sinus by those arachnoid granulations or arachnoid villi, and that's going to put it back into the system. And this is just going to be an enclosed system, just like a fountain, and that cerebral spinal fluid is going to be constantly being reabsorbed. But there's a lot of information that we can get from cerebral spinal fluid. There's, like, for example, meningitis. We talked about that in another lecture. Meningitis, actually, you can identify with something called a spinal tap. It can also be used to identify Alzheimer's, multiple sclerosis. You just have to go into this and tap it like you would tap a tree. So if you've ever seen like anybody tap a tree for sap before, like to make syrup, you know, if I have a tree in the ground, what they'll do is, it's pretty simple. They just drill into the tree, they put a tap in there, and then when they open up the tap, the sap that's in the tree, there's pressure in there. The sap is being moved around the tree with some pressure. So when you tap it, the pressure is just going to push out the sap, and then it can be collected. That is exactly what happens here. So if you think of it in that way, it might help it make a little more sense. But let's take a look at the actual content. So what is a lumbar puncture? So essentially what they'll do is they'll take a needle and they'll put it into the subarachnoid space of the spinal cord, and they'll pull the cerebral spinal fluid out of that space. So where does it happen? Usually it's going to be between the L1, L2, or the L3 and the L4. They'll have the patient bend over, and then that allows the needle to get in to that space. So if you look on the vertebrae here, you can see up too high, you can't see that spinal cord if I bend forward. But if I come down to the lumbar vertebrae and I bend forward, you have immediate access to that spinal cord. That is why they go into the lower back, that lumbar spine, they go into that area. So they'll go in and they'll put something called a manometer in. And all a manometer is it measures pressure. And that manometer is going to be used to determine the amount of pressure. If there's too much fluid in there, it's going to be too high pressure. And if there's too little fluid, it's going to be too low of pressure. And that could lead to headaches or some real problems down the line. But also, you can look and see if there's blood in there. So for example, if there's blood in there, that's not good. There should not be blood in your cerebral spinal fluid. That's the sign that you might actually have a tumor, because there's bleeding going on in that area. Also, they can look for viruses and bacteria if there's a cloudy color. There's certain proteins that will be present if Alzheimer's, so you can see if someone has a pre-Alzheimer's condition or multiple sclerosis. So this is a really very effective diagnosis tool to try to figure out if somebody has a condition that's neurological or based in the nervous system without actually having to open the person up. So I'm going to show you a quick video of a lumbar puncture. So this is a short video. It is a little bit graphic, so I will give you the warning that you will see somebody getting a needle put into their back, but there's no blood or anything, so I think it's okay to show.
This patient had a new onset seizure and had maybe a subacute stroke, but he was having some neck stiffness, so we want to make sure there is no meningitis or bleeding in his head, even though the CAT scan was originally negative. As you can see, I'm using iodine to clean the area. Patient's position is right lateral side. He's a little angulated, but he's a little confused, hard to follow instructions. Nurse getting ready on the back side to help me in case the patient moves or whatever. I'm localizing where I'm going to numb the area. Now we should use the L4-5 or L3-4 space. We use the iliac crest, the hip bone, to direct us straight down to the spot where we feel the space, and then one space right above that. This is just lidocaine, so there's no real big importance if the patient moves a little bit or not. We just inject like half a cc just to flare the skin and provide some numbing.
So what's going on here is this is an anesthetic. So they have to put a needle into that area. So this is just a local anesthetic that will numb the nerves so that way there's no pain that's felt. So this is not a painful procedure. It's just an uncomfortable procedure.
Back, inject, and we go the whole length of that needle. That's at least 2 inches deep. Numbing medicine. We use lidocaine 1%, no epinephrine, and we just continue that all the way through. Now this patient was extremely perfect for this case. You could feel the spaces very well. You know exactly where you were going here. Patient felt some pain, so we stop, give the medicine some time to work, and then we inject medicine as we come out.
So that was just the anesthetic, so that way when they put the spinal needle in, they can. So this is the actual needle for the spinal tap.
The spinal needle, and we use that same space, and we just go perpendicular to the skin, pointing towards the belly button, the navel. And I pull back to see if I'm in that space. I haven't gone deep enough, so I put it back in, and I go in a little further, and there it is.
So now what this is showing is he has now gotten into that subarachnoid space, and you can see this is cerebral spinal fluid that is being dripped out. And it's the pressure of that fluid that causes it to drip out.
Or yellow or thick, then we think there's a problem going on. Either they have meningitis or they have bleeding and so on. Now this spinal needle is very thin. The advantage of a thin spinal needle is less likely to cause trauma and post-spinal headaches. Obviously less pain at the side, less likely to cause bleeding or problems. But the disadvantage is that it flows very slow. The drops just fall very slow. So I have this at 4 times the speed. Those drops are falling in.
So what he's looking at here is he's trying to determine a few things. What's the color of the fluid? If it's clear, that's what you're looking for. If it's cloudy, that means there's some bacteria in there that shouldn't be there. How fast is it flowing? If it's coming out too quickly, that's too much pressure. If it's coming out too slowly, it's not enough pressure. So this is just a great example of what a lumbar puncture looks like. So this is just a great diagnostic tool. You can go in and you can get a lot of information about a patient without having to actually be too invasive. Now the recovery is very simple and you can get a lot of information from that. And the last thing we need to talk about is a condition which is a serious one, but thankfully has a treatment option that makes it work out. And it's called hydrocephaly. And hydrocephaly is a condition where an individual produces too much cerebral spinal fluid and it doesn't get absorbed, and it ends up building up in the brain, and the ventricles are going to expand, which will cause pressure, and it would be the same thing as a subdural hematoma. It would be that pressure which would be deadly. So this could be a deadly condition. Now you can tell a baby with hydrocephaly because they have a very enlarged head, and that is because their skull is still soft and those fontanelles haven't hardened yet. So it allows the skull to expand with the brain. But at a certain point in that development, at a young age, that skull is going to become completely calcified and harden, and then if there's still that pressure from the brain expanding, that could cause some serious problems, obviously death being one of them. So what you see here is you see a normal brain. You can see the ventricles that are full, and then you have the flow of cerebral spinal fluid. It comes back up, it gets reabsorbed. In a brain with hydrocephaly, hydro means water, cephaly means head, so it means water on the brain, and what ends up happening is you have excess cerebral spinal fluid. So those ventricles start to expand and they push out the brain matter into the skull. And obviously, that's going to cause some problems. So, how do we deal with this? That's a problem, right? Well, thankfully, like I said, there's a treatment, and it's a very effective treatment. It's called a shunt. And what they do is they'll put in this thing called a shunt. It's essentially a tube that they'll go. Now, you will see a small tube on the side of. I remember I had a friend in high school that had this actually. He had a little tube that came out from behind his ear and went right back in at his neck. And, you know, I sat behind him in class, and I always be kind of looking at it, trying to figure out what was going on. And he had hydrocephaly. And what it does is it pulls all the excess cerebral spinal fluid out through the shunt, and then it's going to then go into your gut. Usually it'll go either into your abdominal cavity, or usually it goes directly into your bladder, and then you just urinate out the excess cerebral spinal fluid, and it solves the problem. As long as that pump is working and as long as that shunt is clear, you will never have a problem with this cerebral spinal fluid buildup. Now, obviously, there's some upkeep there. There could be issues with the shunt. Things can go wrong. It can get pulled out. That's why you need to have the maintenance involved. But for the most part, it's a very solvable problem. The shunt gets placed in there, and then you get the reabsorption of that cerebral spinal fluid, and you're going to have, you know, problem solved essentially. And that's called hydrocephaly. Thank you very much.